The broadcast is now starting. All attendees are in listen-only mode.
All right, well, good afternoon, everyone. Welcome to today's webinar, and thank you for joining us. My name is Sandra Vandenberg, and I'm the Associate Director for the Michael and Susan Bell Center for Healthy Living, which is hosting today's seminar. And the center's mission is healthy children in a healthy world. Before we get started, I just want to have to make some housekeeping announcements. So first of all, this webinar is being recorded and will be archived along with the presentation slides on our website at msdcenter.org. And then if you have any questions during the presentation, please enter them into your questions chat box. And we will make sure that we have some time at the end of the presentation for Q&A. And at this point, I'm very honored to introduce our two speakers, Jeremy Everett and Dr. Elaine Waxman. So Mr. Everett is the founder and executive director of the Baylor Collaborative on Hunger and Poverty. And the collaborative integrates research and practice through projects such as the Texas Hunger Initiative, the Texas Hunger Initiative, the Research Fellows Program, the Global Hunger and Migration Project, and the Hunger Data Lab, among others. And Jeremy earned a bachelor's degree from Stanford University and has a master's of divinity from Baylor University. He is a next generation fellow from the University of Texas LBJ School's Strauss Center for International Security and Law. And he's also a senior fellow with the World Hunger Relief, Inc., and was appointed by U.S. Congress to serve on the National Commission on Hunger. And then our second speaker is Dr. Elaine Waxman, who is a senior fellow in the Income and Benefit Policy Center at the Urban Institute. And she's also the co-director of the Institute's From Safety Nets to Solid Ground initiative. And prior to joining the Institute, Dr. Waxman served for 6 years as the Vice President of Research and Nutrition at Feeding America, where she oversaw research on food insecurity and nutrition, federal nutrition programs, the intersection of hunger and health, and the circumstances and experiences of individuals seeking charitable food assistance. So together, Jeremy and Elaine will be presenting this webinar called Meals to You, Addressing Child Hunger in the Age of COVID-19. So at this point, I would like to hand it over to our two speakers.
Well, thank you, Dr. Vandenberg. It's great to be with you all today, and I know that you all are calling in from around the country because of the influence of the UT system in this particular space. Your Dr. Vandenberg and her colleagues are leaders in the space that our team looks to help us ensure that we're going the right direction. And so I'm going to tell you a little bit, the way that our session will go today is I'll tell you a little bit about what food insecurity looks like in America, particularly as it relates to our children, and give you a brief overview in that regard. And then Dr. Waxman is going to go in depth with what's happening with child hunger during the pandemic. And then after she speaks, then I'll come back and tell you a little bit about an intervention that we call Meals to You to address rural child hunger during the pandemic. And then Dr. Waxman is going to point to the future. Where do we see this going? And then we'll open it up for Q&A. But as Dr. Vandenberg said, I'm Jeremy Everett. I am the Executive Director of the Baylor Collaborative on Hunger and Poverty. Many of you know our first project that was launched a little over a decade ago called the Texas Hunger Initiative. And about 5 years ago, I had the privilege of being appointed to a congressional commission called the National Commission on Hunger that she referenced. Our job during that time period was there were 10 of us. It was a bipartisan commission, and we were supposed to travel the country to listen to experts and what they were seeing were the root causes of food insecurity, to listen to individuals who are experiencing it, and then ultimately to meet with organizations that were addressing it as well. So we spent the better part of 2 years on the road, visiting with individuals and families and these organizations across the country We would also hold large public hearings when we would go into communities so that we could identify experts that we wanted to testify before our committee, and then also open it up to anybody that wanted to have their voice heard and recorded for congressional record. One of those trips took us to the American Southwest, where we spent the better part of a couple of weeks visiting tribal communities and some of our rural communities in the American Southwest. We ended up in El Paso. That was the final, that was the destination point of that particular trip, where we held a public hearing at the LaFay Community Center in downtown El Paso. Now, the community center, when we opened it up to the public, was jam-packed. Word had gotten out that this hearing was happening, and there were hundreds of people that crowded into the community center that wanted to have their voice heard and wanted to echo sentiments articulated by their friends and colleagues in the community. One of the invited testimonies was given by Texas A&M professor, Dr. Joe Sharkey. Dr. Sharkey is a public health professor. His research is largely around what's happening on the Texas-Mexico border in the colonias. And so he got up before us and he sat down at a table that was kind of seated below a large platform where we were seated. And as he was looking up at us, he began to recount a story that had left an indelible mark on his life. He had a number of public health workers or promotoras who were from communities in these, around the colonias and in the colonias, which in the colonias, if you're not familiar with them, are unincorporated towns on the Texas-Mexico border, where people, often immigrants, move to land where they lease the land from a landowner, but they don't actually get a lease agreement. So they're essentially paying rent to use land, and then they construct a home from whatever they can find. So it's not uncommon to see maybe a trailer next to a home that might have one wall made of corrugated tin, another made of rocks from the surrounding land, maybe even a few spare tires kind of stacked up to make a wall. A lot of our colonias don't have any kind of public infrastructure. They may not have electricity or running water or roads. And so much of what Texas A&M and Dr. Sharkey's colleagues have been doing is cataloging the stories of what's happening there, the needs of what's going on down there, and then working with some of their counterparts to begin to put in some of this infrastructure. Now, unfortunately, the families who live on the public land or on this land where they're leasing it, the landowner can come and take it anytime they want. So they may have spent a lifetime there. They may have actually built a home there over the course of their lifetimes, and the landowner can come and take that property really with no recourse. So it's really an unstable place to live. And if you haven't been there, I would encourage you to visit these. It's hard to imagine that these exist in a country that we would consider a developed nation. Well, one of his public health workers, a promotor, was from a particular colony, was going door to door asking a survey of questions that Dr. Sharkey had prepared. And she knocked on a woman's door, and the woman invited her in, a woman named Maria. And Maria began to answer the questions that the promotor was asking her. And towards the end of her survey, the promotor asked Maria, she said, "Do you have any food in the house?" And Maria's head lowered under the weight of shame and guilt, and she made her way over to the area that kind of operated as the kitchen. And she had spliced electricity from a nearby home, and so they had a small refrigerator there. And Maria opened up the refrigerator quietly, and the promotor looked inside the fridge, and nothing was there except for a bag of chicken bones. And so the promotor asked, "Why, Maria, is there just a bag of chicken bones in your fridge?" And Maria said, "This way, when my kids get home from school and they open up the refrigerator door because they're hungry, they'll at least see that something's there." I think because we see so many billboards about hunger, because it is seen as such a charitable issue, that oftentimes we miss the reality that if somebody is experiencing food insecurity in our nation, that they have a myriad of issues that are going against them. Whether it's legal status, immigration status, whether it's access to consistent, a good paying job, you name it. They've got a myriad of issues that they're experiencing. And these issues, when you go into somebody's home that is experiencing food insecurity, oftentimes it has a distinct smell, a smell of the reality, the harsh realities of many of our broken social systems. What we found as a commission were that families were consistently forced to make trade-offs. Many of you are familiar with social determinants of health, and so it won't surprise you to know that most families in America that are food insecure are employed, but they're underemployed. They might be making $7.25 an hour, and if you make $7.25 an hour on a 40-hour a week job, that's still only about $13,000 a year. Oftentimes, that's not even going to be able to cover your rent, much less any kind of car payment or paying your electricity bill or transportation costs or childcare costs or certainly healthcare costs. So families are forced to make trade-offs to determine what are they going to use their money for. We also know that families who are in low-income environments that are considered underemployed don't have predictable hours, that each week they don't know what their shifts are going to look like. So one week they might be able to get 30 hours, but the next week they may only get 15. And so all that has a direct effect on their ability to purchase food and knowing whether or not they're going to be able to have enough money to purchase adequate food for their family. So families are forced to make trade-offs. Oftentimes, the trade-off that they make is either choosing not to buy food towards the end of a pay period. Oftentimes, the parents might forego eating so that their kids can eat, or they're forced to buy unhealthy processed foods, foods that are unfortunately readily available in our low-income communities across the nation, and oftentimes the only thing that people can afford and have access to on a regular basis. Now, the typical story that we hear when it comes to child hunger in our country is one that was told to me by one of my colleagues who was a school social worker early in his career, Doug McDurham, and he was mentoring a young man who was a junior in high school. And he began to see the students' grades improving and discipline problems decreasing throughout the school year. And Doug, as a young social worker, felt very proud, like his efforts were making a difference. Only towards the end of the school year to see his student beginning to fail courses again and getting in trouble again. So Doug, out of frustration, pulled the student out of the classroom and he said, "What in the world is going on? You were doing so well." And his young student said, "I realized that if I could fail at least one course, then I'll be guaranteed to go to summer school. And if I go to summer school, I'll at least get one meal a day during the summer." That's the reality of child hunger in America. It's not something that we have to live with. We certainly produce adequate food to ensure that everybody would have access to 3 healthy meals, no matter where they live in our nation. And we'll talk a little bit about how we can do that together. But that's the state of hunger in our nation. And that was before the pandemic. And so Dr. Waxman is going to tell us a little bit about the long lines that we've all seen in front of food banks and the stories that we've heard during the pandemic. Certainly when we go to the grocery store and we can't find food on the shelf, it's beginning to hit, this issue is beginning to hit home for all of us. So Dr. Waxman, if you would, tell folks what you're seeing during this pandemic period.
Great, thank you, Jeremy, and thank you for providing us with that context, because I'm about to share some statistics, and it's very important to hold those individual lives and stories in our minds and hearts as we look at those numbers. I wanted to just start by saying that I'm sure many of you are familiar with the big spike in food insecurity we experienced during the Great Recession. And what's interesting is that it took us about a decade to get back to pre-recession levels. So just in 2018 was the first time we had seen household food insecurity back to what we were experiencing mid-2000s. And I think that's instructive, because what that tells us is that even if the pandemic is to resolve in the near future, as we would all hope, the extent of the economic shock and dislocation we've experienced suggests that we will be managing high levels of food insecurity for several years to come. And of course, that's a very sobering prospect. Just about the end of March, Urban Institute, where I work, which is a nonprofit, nonpartisan research organization based in biannual survey, which we called the Health Reform Monitoring Survey. And the purpose of that survey was to keep an eye on healthcare coverage and access. And that's been running for several years and provides quicker statistics than you usually get from government data. And we realized then that it was about to field at the time that the shutdowns had just begun. So we quickly added a series of questions around material hardship and food insecurity and other experiences people might have been having during COVID-19. And so the data I share with you today both comes from that late March, early April survey, a nationally representative sample of adults and their families, and also a repeat survey that we did then again in mid to late May. We will then repeat it again in September, so we'll be able to provide you an update in early fall. But that's where the data are coming from. So next slide, please. So you'll see here from this table a little bit about what we found. So at the early part of the shutdowns and the pandemic, we were seeing about 1 in 4 families experiencing food insecurity, and about just of all adults, about 1 in 5, which is a striking jump. It's difficult to compare exactly with pre-pandemic data for a number of reasons, but we know that that rate was significantly lower just at the beginning of the year. In particularly concerning, we know that children and their families are always at higher risk of food insecurity, and that's being borne out now, but we haven't seen these rates in quite some time. I want to also call attention to the fact that the yellow bar is the May survey, and what it does show is a little bit of moderating of those food insecurity rates after about 2 months in. And that's encouraging in the sense that, we had a number of strategies that were undertaken pretty rapidly, including increasing emergency allotments of SNAP benefits for many households, although not all. We'll talk about that later. Also, efforts to get meals to students who were experiencing closures. And of course, boost in unemployment compensation and stimulus checks, all of those things, we would expect to have some impact. Nevertheless, the rates have persisted pretty high. The other thing I want to call your attention to is if you look at those shorter bars, on one side is all adults and the other side is all parents, those shorter bars reflect very low food security. So food insecurity in any form, whether it's a reduced variety and quality of diet, as Jeremy described, and uncertainty about being able to stretch resources, or whether it's the more extreme experiences, which we characterize as very low food security, which might be going without a meal for a whole day, or skipping meals on a regular basis. Those are pretty high numbers, so almost 1 in 10 among families with kids. And we worry about any kind of food insecurity having long-term, both long-term and short-term health consequences, but the very low food security is particularly troublesome. Next slide. And so advance again. So just to quickly recap, these are 30-day lookbacks. So in May, we were again seeing among all adults, 1 in 6 adults who were food insecure, 1 in 5 parents with children. Advance again. And another interesting fact that bears directly on the program that Jeremy is going to talk a little bit about is the fact that although school districts were undertaking really heroic efforts to try to get food out to families who were missing meals because of school closures, at least our survey in May suggested that quite a few of those families who had been receiving free or reduced price meals were not receiving them in the prior 30 days to late May. So about 2 in 5 parents reported that even though their kids had received free and reduced price meals during the school year, that they were not late in the spring. So that is concerning because that's being layered on top of the fact that there's already persistent food insecurity among families with children, particularly low-income families. And that despite our best efforts, we may not have been reaching a lot of those households, including, I'm sure, a number of rural households. And so that makes the program that Jeremy's going to talk about even more important. Next slide. So I'm going to show you on the next set of tables a little bit of the breakdown of what food insecurity has looked like in the last few months. And in the red box, you'll see some really concerning data about racial and ethnic disparities. So I always like to start by saying that survey research is limited, particularly when it's done in a short turnaround time. So we don't have the sample necessary to break down other groups that you see listed in that bucket of other. But in no way does that mean that we should not be digging in deeper, because certainly one of the groups that has been particularly hard hit are Native American or Indigenous communities. Those numbers don't always rise to visibility in national surveys, but we know that those communities have historically high rates of food insecurity, and we should be really paying attention to that. You'll see, though, that the other place where we've got big disparities, and again, this is a historic story, but exacerbated right now, and that is between white households experiencing food insecurity, about 13.5% of adults, versus not quite a third of Black and Hispanic or Latino households. And so again, we need to think about who's being hit particularly hard by the pandemic in general. So we know that communities of color have experienced higher rates of COVID-19 and COVID-19 complications. They also are often more likely to work in industries that have high rates of exposure, so they may still be working. Alternatively, they also are represented in industries that have had significant layoffs, for example, a number of service industries. So that red box is there to remind us that we need to really be sounding an alarm and understanding that the experience of all families with children is not the same, and that our solutions should not be the same given those really big gaps. So next slide. So I'll just quickly talk about some of the strategies that you may have observed in your own communities that school districts undertook quickly once the shutdowns began in March. And these were all predicated on waivers that the US Department of Agriculture needed to grant. Because normally school meals are only eligible for reimbursement if they're provided on site, if they're provided at certain times of the day, and any number of other requirements had to be waived in order to create a community-based response. One of the most common approaches was a sort of a grab and go. I live across the street from a Chicago public high school, so I could see this out my window. Was families who came, in some cases every day, or some schools switched to a couple of days a week to pick up meals that would replace breakfast and lunch. Other places use other types of community hubs, so maybe they partnered with Boys and Girls Clubs or other locations where families might easily get to. Some areas, particularly maybe suburban or more rural areas, went with bus routes, and they actually employed their school buses to make stops to distribute meals. And then we'll hear in more detail in a minute about an innovative approach to use home delivery to reach families for whom going to any kind of central location, even a bus stop, might be very challenging. Next slide. And here's just a few examples of things that we're undertaking around. One of the challenges was immediately recognized by districts. And that is that, you know, it wasn't just kids that were hungry, but all of a sudden many adults in the household were also maybe thrown out of work. And so a lot of school districts either solicited donations to cover cost of providing meals also for parents, or tried to offer them at a low cost in order to make it a more robust response. In Austin, that school district was one of those that used school buses, and there was a website that you could actually track where those bus locations were going to be. New York City, very different kind of environment, actually partnered with DoorDash to get home delivered meals to medically fragile students that they were already aware of across the boroughs. And in the case of New York, combining that with a variety of other strategies, including grab and go and lots of sites. And Boston, like a number of other districts, used an interactive map, because one of the challenges of meal distribution sites is that they open and they close. If there was a positive case at a site, a team might have to shut down and they'd have to shift that grab and go site to another place. As they shortened the number of days that were available to try to ease the burden on staff, a lot of that information was changing, and that may be part of the reason why not all families were reached consistently. But again, many of those strategies, while incredibly creative, wouldn't work so well in the environments that Jeremy was talking about earlier. And so hence the folks at Baylor had already begun working on an innovative pilot on home delivered food meals in rural areas, and just happened to already have that underway when the pandemic hit. So Jeremy, I'll turn it over to you and let you talk a little bit more about what that looks like.
Thanks, Elaine. That was great. And I want to piggyback on one thing that you said, kind of calling out some of the numbers. In the other category, it showed that 13.8% in terms of the other category were food insecure during this period. But to her point, if you dive a little deeper, one of the communities that we're working in is in the Navajo Nation, and the Navajo Nation itself has over 78% of its population that's food insecure. So when you dive in deep, to her point, it's we certainly have a lot of inequity in terms of food access around the nation. Well, our project, and you can go on to the next slide, is a project that we call Meals to You. And a lot of us on this call are researchers or work with different research institutions. And our project at the Baylor Collaborative on Hunger and Poverty, we are a research and innovation shop. And so we are typically testing out anywhere between a half dozen or a dozen different interventions that could be potential scalable solutions to addressing hunger and poverty, whether that's domestic or global. So our job isn't to maintain them for the long haul, but it is to test them out in the short term to see what could potentially move the needle. Our smallest project a year ago was this project we called Meals to You. And it was largely born out of some work, out of what we identified as a commission, which was that our interventions that were working in urban America were not necessarily translating well to rural America. And the work that our field staff. So we have the Texas Hunger Initiative team has 7 regional offices around the state of Texas. And so our field staff are in relationships both with these large urban school districts like Austin ISD, but then also rural school districts around the state and rural communities. And so our job is to organize communities and organize a public and private response to addressing the issue. And one of the things that consistently came up that I would hear year in and year out from superintendents who oversaw school districts in rural Texas, as well as what we heard when I was on the commission, is that their kids live too far away to be able to get them to a summer meal site when school was out. And so USDA funds summer meal sites all around the country, but they require a congregate. There is a congregate requirement that accompanies those summer meal sites. So meaning that kids have to go physically eat on site with other kids during a designated time, and they have to eat that meal there in front of somebody that is responsible for ensuring that the child eats a meal and so on and so forth, to ensure that that is an actual reimbursable meal. Well, many of our kids in Texas alone might live 45 minutes in one direction away from their school or from a nonprofit organization. And so their family, certainly can't afford to transport their child all the way in town for a quick meal and then to get them back home, nor can the school districts afford to send their school buses out there in normal times. So we were trying to think, if we couldn't get the kids to the meals, how do we get the meals to the kids? And so we've been trying a whole host of innovative strategies to address summer hunger for a long time as a nation. One of them that worked very well was called the Summer EBT program, where we put extra resources on SNAP or WIC cards for families. And that program worked incredibly well for kids that live in urban and suburban areas. But again, in rural America, not only do you live far away from a school site, you also oftentimes live a long way from a grocery store. And so that solution wasn't working for our kids either. So we ultimately determined, what could we do utilizing USDA summer meal programs and utilizing kind of the system as it is, or what are some of the gaps that we could fill? So our team began to have conversations in conversation with the USDA and school districts and with industry. We determined that we would actually mail a box of food to kids for each week that they're out of school. So we launched this program last summer. We called it the Meals to You program. We had 20 school districts in East and West Texas that were a part of a pilot, a 10-week pilot for about 4,000 kids. And during that summer, we mailed them shelf-stable meals, which, because we were using traditional transportation platforms, so using UPS or USPS to actually mail the boxes to the front porch of the individual that would be signed up for the program. And it worked incredibly well. So we would provide the kids 5 breakfasts, 5 lunches, and 5 snacks per week. And we served about 485,000 meals and snacks, a little more than that, to kids over that 10-week period. So our team kind of went back to the drawing board. Dr. Waxman leads an evaluation team that is evaluating the implementation. And in conversations with her team and with USDA, we determined that this is working pretty well. Now, obviously, the long-term plan would be that we try to begin to figure out how we can incorporate, more locally sourced and fresh foods for kids, in addition to just those shelf-stable meals. But in these early iterations of the pilot, that was using shelf-stable was our platform, and using UPS and USPS was our opportunity to get the food to the kids. We recruited McLean Global for the first year of the pandemic, or for the first year of the demonstration, to do to actually pack the boxes of food and source the food and then mail the food, while our team worked to ensure efficiency and effectiveness of the program. Well, USDA came back to us after the end of the summer and asked us to expand the program to include New Mexico and Alaska this next year. And so our teams were all collectively beginning to work towards that. When in late February and early March, we got phone calls from USDA, and they said, is there any way that we could scale this program up nationwide? They knew that school districts were likely going to be closing for at least a period of time. Of course, at that point, I don't think any of us realized that they would be closed for the rest of the school year. And so they asked us if there was any way that we could do it. And so our team worked with our vendor. We recruited a couple more vendors because we knew that this was going to be too big for any one organization to tackle by themselves. And we opened it up. Initially, we said we could take on 20,000 kids, and that number grew to 100,000 kids. After the first week of opening up the application process for school districts and children, we had over 100,000 children or families that had applied for their kids. So we knew that we needed to scale beyond that. Ultimately, we ended up serving in 43 states and a couple of territories. There's a map on the next slide that you can see that shows all of where we're serving, with about 300,000 kids that are enrolled in the program. I think 288,000 or so was where we ended up maxing out. And we ended up serving them not just through the end of the school year, but we were able to continue it on, and we'll continue it on actually until tomorrow. Tomorrow will be the last day of service delivery for pandemic version of Meals to You, Emergency Meals to You. And we still complied with USDA child and nutrition requirements as related to the summer food service program. Each box had to be mailed within traditional reimbursement rates for the rural summer food service program, which made it, that was certainly a challenge. Particularly, we had some school districts that are, these school districts represent some of the most remote places that we have on our continent. We have a school district in Alaska where a superintendent called us and said that their families had participated in the program. They were very pleased and grateful for the program, and to let us know that they were 300 miles from the nearest road system. And so these are oftentimes school districts that are in some of the farthest reaches of our nation. And so we were glad to see, that USDA would be open to an innovative approach to addressing both summer hunger for kids in rural America, but then also hunger during the pandemic. We were grateful that they did, with Congress's leadership, that they provided waivers so that we could have some creative implementations like the curbside meal program that we saw all across the U.S. And so we certainly know that these kinds of things, one of the things that we've learned about the pandemic is that there are a number of our rules and regulations that were certainly prohibiting kids from accessing meals that needed to access them. And so, part of my hope is that as we have learned some of these lessons and learned how to overcome some of these barriers to access pre-pandemic, that we will use what we learned during the pandemic to help us build and create more effective public policy to ensure that we're reducing hunger beyond the pandemic. As Elaine mentioned at the beginning of her talking points, one of the things that we know, and I was a community organizer early in my career, is that when you go into communities and you ask them, hey, how can we walk alongside you to maybe address some of the needs in the community, that there is a level of transference that takes place. There's a level of expectation that you're not just going to address that problem, but that you're going to continue to work with that community, oftentimes in perpetuity. And because of what we learned during the recession, that it took us 7 years to see food insecurity, begin to just lower back down to pre-recession levels, which were still astronomically high for a nation that is a developed nation as ours is that we know that we're probably looking at long-term investments in these communities for the next decade. Not just we as a collaborative, but we as a nation. We've uncovered some realities that were incredibly harsh even before the pandemic hit. And this has certainly shined a light on some of the injustices and some of our broken social systems that we're seeing daily on the news and reading about in the newspaper, many of which that have existed for a long time. So I think that our plans moving forward are not just this is almost like trauma care, not just how do we stop the bleeding now, but how do we use this as an opportunity to invest in our communities for the next decade as they begin to rebuild their lives after having significant losses during this period. Elaine, why don't you tell us where we're headed? The crystal ball.
I noted the point says looking ahead, but that doesn't mean seeing, and that's unfortunately kind of where we're at. Next slide. I will say, next slide. I will say that we're at a really interesting juncture. And that is that we've had a number of strategies employed this summer, some of which were directly focused on kids and households with kids, like the various adaptations for summer meals and school meal replacement. And some of which were broader and really critical, like the boost in SNAP benefits and the rise in SNAP participation. SNAP being really the primary line of defense that we have in this country against food insecurity. But some things are about to lapse that could put us at greater risk. Next slide. Next slide. So first of all, the other thing that came to bear later in the summer in most cases was a new program created specifically during the pandemic called Pandemic ABT or PBT. You may or may not have heard of this program. And if you haven't, no shame, because it's brand new and it's not widely understood. But it built a little bit on the summer EBT experiences that Jeremy referenced briefly, that had been part of an experiment on how to reach families during the summer. And that is to provide electronic benefits in the amount of the value of school meals that would be lost during closures. Many states were pretty slow to adapt this, in part because, you know, states were being asked to do so many things. But almost all states have now implemented it. It's challenging because if you were already on SNAP, it's not hard to add electronic benefits to a card. But if you didn't have an EBT card, then states had to quickly figure out how to get you one, how to complete the information necessary, and that's been quite a challenge. But that program has been, I think, important, particularly for families who may not have been able to access other kinds of sites or not had access to the program that Jeremy was just describing. And we're just now, you know, beginning to learn a little bit about PEBT, and as at this point, it's about to lapse. So we will lose that. We are facing a return to school that is quite uncertain, as I'm sure you are all experiencing in your communities. At best, it may be a hybrid model in terms of combining online and in person. We can, I think, expect to experience more closures, unclear how widespread. And so the needs won't go away, but we're not necessarily going to have all the tools at hand. The other thing that is also potentially going to lapse is the emergency boost in SNAP benefits. So during the Families First Act passed in March, Congress appropriated funds that allowed states to boost the amount of SNAP benefits available to households up to the maximum. I emphasize that because it did not boost the maximum benefit. And that is important because even in better times, the maximum benefit does not cover the cost of a low-income meal in 99% of US counties. So SNAP benefits are already not adequate for those families who would receive the maximum, which means that you're considered to not have resources available for food. So even, but just even having those boosts for other households has been important. But as of now, there's no action on continuing that past the fall. And as you all know, we're waiting to see what Congress may do in terms of other actions. One of the things that was done during the Great Recession that was quite effective was to boost that maximum SNAP benefit a little under 15%. And we know from research that that had an important impact on reducing food insecurity. And the other thing we have to remember about SNAP is that SNAP is also a local stimulus. So when people spend SNAP benefits, that goes back to paying the wages of cashiers and stock people and producers and growers, and provides money back into a community at a time when the economy can be really depressed. So it's an evidence-based strategy that we know worked during the Great Recession. There is in the HEROES Act a provision to boost that maximum SNAP benefit, would also then keep everybody's benefits increased for some period of time, but we don't yet know what's going to happen there. So we may be losing PEBT, we may be losing the opportunity for enhanced SNAP benefits, and we certainly are looking at a reopening that is uncertain and mixed at best. And as I started with, if you work in food insecurity and social determinants of health, the racial and ethnic disparities are not news to you. But the exacerbation of those at this time and the ways that they are intersecting with other impacts of COVID are really concerning. And it raises the question of how we will address those if we're doing the same thing in every community, as opposed to going deeper and more intensively in those communities that are at highest risk. So that's where I think the current landscape is. So I'm afraid I don't have a very good crystal ball. But I think it's a really important juncture for those of you who are working in healthcare. This is a time where families who might sort of out strategies to get by, who may have had some success in returning to work or getting more hours, may in fact be once again facing risk, and something we all need to be aware of.
Thanks, Dr. Waxman. Dr. Vandenberg, we can open it up for some questions, and I'm sure that we're getting a few. And I will say, as we're transitioning to the Q&A, one thing that we did, we were able to ultimately, by the end of tomorrow, we're expecting that we will have served about 40 million meals to kids. We've had to change how we serve meals. We do serve them in 2-week boxes. That was one way we could reduce food transportation costs and put more into food quality. But I just want to say thanks to Dr. Waxman and the work that she's doing. It's really kind of pointing us all in the direction that we need to know about. And though the crystal ball unfortunately looked a little foggy, I think that it certainly does speak to the state of our nation and some opportunities that we have ahead to improve things. And but it's going to be certainly quite a challenge, as we all know. Well, Dr. Vandenberg, what do you have for us?
All right. Well, first of all, I just want to say thank you for a great presentation. Loved hearing about the intervention that you're doing, and yeah, very, very interesting. And what a great way to help families right now that are needing more access to food. So there are several questions. First one that I'd like to ask is, I have this question as well. So can you tell us a little bit more about what the meals or the boxes look like? And can you give some examples of the content? And then the question here, and I think you already answered it, were breakfast and lunch packaged together? It sounds now that you have multiple days packaged together, correct?
Yeah, well, they're individually, so it comes in a box, but they're each individually packaged per meal. And this, as you can imagine, with the supply chain disruption issues that we've all been facing, it has been we've really been fortunate that our vendors have been able to be able to access the foods at the highest quality possible that they could, given that it's shelf stable. So the meals are typically like whole grain food or whole grain cereals and those kinds of things. Milk is incorporated into everything. There's typically a protein-based entree with some kind of a vegetable that accompanies it. But I will say this, and this is something that, one of the reasons I wanted to speak to you all is that I know that many of you work in increasing healthy food access. And so, and that's a big thing for us. That is an area we've got to figure out how we can get these meals to kids in an affordable way. So likely continuing to use transportation means like a USPS or a UPS. But being able to provide the healthiest quality meal that we possibly can, obviously, without question, the lowest standard is to ensure that they meet the nutrition guidelines of USDA. That's kind of the baseline. But then how do we use this as an opportunity, particularly in these areas that would be food deserts, that don't have access to healthy food on a regular basis? This gives us a chance to maybe to right the system. And so, for those of you who are particularly oriented in that space, please look us up. Go to our website, hungerandpoverty.org, and let us know point us in the right direction, or tell us how you might be able to help us out to increase the quality of food, ideally beyond shelf stable, moving forward with the demonstration.
Yeah, I can imagine it'd be hard to be mailing fresh fruits and vegetables, for example.
Right. Right.
I'm going to talk to you later. I'll email you.
Great. That's great.
So another question, are emergency meals, or is emergency meals to you only operating in rural areas?
It is for now. That was what USDA had demonstration authority over. And so for now, it is continuing to work with USDA rural designated school districts or schools. Some school districts around the country might be county-based, and or in Louisiana, it's parish-based school districts. And so you might have some that are urban serving schools, and then some that are rural schools. But by and large, we're looking to address rural hunger with this particular intervention. I think what we're all learning at this is that this could be an intervention that could work in both urban and rural areas. And so we'll be interested to see what Congress wants to do with this. So there seems to be a lot of bipartisan support for this particular intervention. And so we'll see what the next phases might look like.
Okay, great. Another logistical question. How did you get approval for giving out 2 weeks worth of meals at a time? And I'm assuming that is probably the approval from USDA.
It was, and that's
sure.
And that, yeah. So USDA was able to do that because of their demonstration authority with the Summer Food Service Program, and so they were tasked by Congress to come up with some creative ways to address summer hunger for kids in general. That also gave them the demonstration authority to create and expand the summer EBT program that we referenced, which, just for the record, we've tested that out. Our team has been involved in the evaluation of it in North Austin and in El Paso repeatedly over the past handful of years. Really, we need that program to be a nationwide program. We've got plenty of data right now to support the fact that it is a great program, and typically has over an 80% utilization rate. And that's money that kids or their families are able to take to the grocery store and spend and use. But so USDA was given the authority to be able to try that out to see if it would work. And then they were instructed by members to focus on rural hunger, that they were recognizing that USDA solutions to addressing summer hunger were not working in rural America. And so they were directed to come up with a new innovative pilot. And so we pitched them this one, and they were eager to try it out. And so we were glad that we've been able to do it. We don't know if we'll revert back to the 3 states that are a part of the summer demonstration project next summer, or because of this 43, state and territory intervention during the pandemic, if they're going to want to expand that. But we're certainly eager to know and have those conversations after the summer wraps up.
Right. Thank you. Okay, another one. Do you think that there will be an increase in routes and the use of public transportation now that it can be seen that many people do not have access to a car?
Elaine, what are your thoughts on that?
Yeah, I think that's it's really interesting, because the pandemic is certainly obviously bringing into stark relief a number of pre-existing problems, one of which, of course, is lack of access to transportation for a lot of at-risk communities. At the same time, the pandemic itself has made people sometimes reluctant or unable to use transportation, and has also curbed the availability of some of that transportation. So it may be that we have to get to the other side of the pandemic before we see any real movement on the sort of structural issues around transportation. But I think it's clear that there is an intersection of the pandemic with a lot of challenges that already exacerbate insecurity. And in doing a number of interviews in the past year, prior to the pandemic, one of the #1 things that families who were experiencing food insecurity raised with us was transportation. So the significant amount of their income that was going to transportation, either to try to maintain a car or to get public transportation or to pay for rides with family or friends or strangers, and that is very high on people's lists. So to get transportation people and food insecurity people in the same room is going to be really critical for some long-term progress.
I do think in the short term, it's going to be contingent upon what local communities do. Obviously, we're not seeing a coordinated national response to a lot of these issues in a timely manner, and so I do think that local communities are going to have to step up to address this. And I know we've had conversations in our community with our mayor and city council about this. repeatedly. They certainly seem to be open to it and have been trying to increase bus routes and the times that buses are running and so forth to try to get people back and forth to grocery stores. So I don't know who made that observation, but it is an on-point observation. And in places like Texas, for those of you who do live in Texas, you know, public transportation is not our spiritual gift. I mean, we are not. We don't do it very well, and that's an area where is big and is spread out as we are. That is an area that we know repeatedly hurts not only food access, but it also prevents people from accessing good paying jobs. So that's a good observation.
Yeah. Elaine, I have a question for you. Could you tell me just a little bit more about the evaluation that you're doing for the project, for the intervention, and are you actually looking at rates of insecurity?
So we have a few different things going on. The data I presented at the beginning is sort of a periodic national survey, and we will be using some of that data as sort of a comparison for families with children to look at that alongside data that we're collecting directly from households that are participating in emergency meals to you. As you can imagine, doing research during the pandemic, as many of you probably have experienced, is pretty challenging. But one of the main things that we've done is realize that you know, participant voice is critical to understand what's working and what's not working for households. So we have fielded now twice a round of online surveys that we also can mail out or do over the phone for families who can't access online. And at least in the first round, I think the participation rate was up over 50%, which is really good for a survey. And I was pretty astonished that we were able to get to that level. We did offer a modest incentive, but it's a very challenging time for households. But that survey asks food insecurity. It asks about other sort of barriers to food access. It asks about experience with the program. We're repeating that here at the end of the summer as the program comes to a close. We'll be able to look at that. And obviously in this circumstance, you can't do anything that looks like a randomized control trial. That was our hope, to do something more experimental when we started planning the summer meals to you expansion. We had to put that aside, obviously to recognize the current circumstances, but we'll still try to provide as much rigor as possible. We'll also be, we're currently conducting a survey with school districts to see how they experienced the enrollment and engagement with Meals to You, interviewing the vendors, of which there are 3 major vendors who have provided the actual food boxes, and doing some qualitative interviews both with families and with school district personnel. So those are sort of all different threads that we'll bring together this fall and try to understand, you know, how it worked, what lessons we can learn for the future.
And then we also have Duke's Global Health Institute is also, we've recruited them to help specifically with what I spoke of earlier around the nutrition quality of the food that's being provided, as well as looking and pointing towards the future of what this program could potentially do. So we've asked them to help us out, and so they've very recently stepped in to fill that void. I think like most demonstration projects, we assumed that it would scale up slowly, and so going from 20 school districts to 43 states, I don't think we had planned on. Well, I know we didn't plan on, and so the good thing is it's a flood of data. I mean, we probably have 5 to 10 years worth of data that we've all been, you know, but because of the intervention, but also trying to catch up to maybe some of the questions that we would have asked in years 3 or 4 of a demonstration like this. We're having to ask immediately. So.
Thank you. We are out of time. In fact, we're over time. So there are still some other questions that we may go ahead and see. Also, y'all people who have been listening. Really appreciate all of y'all being here. And just remember that this webinar will be archived on our website. So thank you again, and we will see you next time.
Thank
Bye-bye.
you.
Thank you.